Hi, I'm Margaret. Welcome to another episode of Did You Know video series. If you are a parent, then you know how important feeding is for your baby's growth and development. But did you know that something as simple as a small piece of tissue in the baby's mouth can make feeding difficult? Today we're talking about tongue ties, lip ties, and buccal ties, otherwise known as cheek ties. What they are and how they can impact your baby's ability to breastfeed and bottle feed. Let's start with tongue ties. A tongue tie occurs when a strip of tissue under the baby's tongue, called the frenulum, is too short, too tight, or attaching in the wrong places. That restricts the movement of the tongue, making it hard for the baby to latch properly and making feeding difficult. A good latch is critical for effective breastfeeding because it helps the baby create the seal and to use their tongue to draw the milk out of the breast. Babies with tongue ties often struggle to maintain latch, which can lead to frustration for both baby and the mother. They might come off the breast frequently or seem like they're not getting enough milk. For moms, this can result in sore nipples, cracked nipples, because the baby is compensating by biting down with their gums instead of using their tongue to be able to draw the breast in properly. Now, let's talk about the lip ties. Lip ties can occur when the piece of tissue connecting the upper lip or the lower lip to the gum is too tight, too short, or attaching in the wrong places. This can prevent the baby from flaring their lips outward, which is essential for creating proper seal around the breast or the bottle nipple. Without a good seal, the baby might swallow air, leading to gas, reflux, and general discomfort. And then there are the buccal ties or the cheek ties. These are less common but still can cause some issues. Buccal ties are tight bands of tissue inside the cheeks that restrict the movement. When these are present, they can interfere with the baby's ability to open their mouth wide to create a deep latch and at the same time create that suction needed for feeding and make it difficult for them to get enough milk, whether they're breastfeeding or bottle feeding. So, if you suspect your baby has a tongue tie, lip tie, or a buccal tie, the first step is to schedule an evaluation with one of our speech-language pathologists who specialize in infant feeding. We can evaluate the baby's oral anatomy and functional feeding patterns. If a tie is present, we may recommend seeking a consultation with a provider that specializes in releasing of the tethered oral tissues. And in many cases, a release may be necessary. However, it's important to know that functional feeding therapy before and after the release is crucial because it helps to prepare the baby and the parents for the release and the post-op care. Therapy also focuses on habituation of the oral motor patterns to ensure proper development of muscle function to support the development of the oral-facial complex. To learn more or to schedule your appointment, contact us today, 815-782-4196, or visit us at mytherapywellness.com, as well as on Facebook, Instagram, and TikTok. Thank you for watching, and remember, working with an infant feeding specialist can help prevent feeding from becoming stressful experience for baby and the mom.
Thanks for watching our Did You Know series. Follow us for more interesting facts. See you next time.